I really appreciate everybody taking the time to show up today, and I know lots of you have questions. So let me do a little housekeeping here before I introduce our guests. So if you would please notice on the far left of your screen, you should have a box that says questions. That is a place for your questions. And we would ask you to keep that only for the questions, and then in the regular chat bar where it says comments only, you can place any of your additional comments that you have there, and I will be curating the questions a little bit later, and we will get them to the doctors. Also want to say that if you have questions that arise after we're finished today, please feel free to send them to me at communications@mccchurch.net. That's communications@mccchurch.net, and I will forward them to the doctors, and we will get some responses back and share them back out with you. So we'll do our best to get to all your questions. And here comes our last presenter. Great. So glad to have everybody here today. And again, thanks to the people that are attending. Thanks to our panelists for helping us answer some of the questions we have about returning to church. So today, to answer our questions, we have Dr. Lori Dick. As you can see there, osteopathic manipulative medicine. It is a mouthful for me to say, but there we are. And Dr. Tracie Traver, who is obstetrics and gynecology, and then Dr. David Williams, who is an ER physician and trauma surgeon. And I am so happy to say that all three of these doctors are also active MCC folk. Some of you know them, and some of you don't know everybody here. So we have Lori, who is a volunteer clergy at Founders MCC. David is an interim pastoral leader, and Tracie is the vice moderator of the board of directors of the church I serve in Knoxville, Tennessee. So thank you all for taking the time out of your very busy schedules, leaving patients behind. I know some of you have been running to see patients in between our testing time and now, so thanks so much for taking the time to be with us. We're going to turn it over to you for some presentation to start with, and then we'll get the questions going. So attendees, put your questions only in the question box, and comments will stay in the comments box. Thanks, and I think we start with David.
Okay, hi, good afternoon, folks. So before we start, one of the things that I'm going to take you through is some basic epidemiology. A lot of times, in the military, we said before you go to war, you should know who your enemy is. A lot of us don't know exactly. We keep hearing the folks talking about different things, about flattening the curve, and they're talking about, why it's important to follow social distancing and so forth, but we really don't know why. We tell you, do this, but we don't tell you why we should do it. So one of the things that I'm going to take you through some of the basic stuff. I'm going to keep it as simple as I possibly can. We're going to talk about things like case mortality rate, and that is the number of deaths divided by the number of cases multiplied by 100. The case mortality rate differs from state to state, and in New Jersey here, we have the second highest number of cases in the country, and our case mortality rate is actually 5.6, where we took, as of yesterday afternoon at 1 p.m., we had 6,442 deaths, and we had 113,856 active cases. That has since gone up, that the number of deaths is now closer to 7,000 more than it is what it is right here. And one of the things, if you want to see exactly what goes on in your area, regardless of where you are in the world, you can go to the URL listed here, which is https://coronavirus.jhu.edu. That is Johns Hopkins. They are charged with keeping track of the coronavirus globally. If we want to continue on epidemiology, we're going to talk about something here. It's technical, but look at it. It's called R0, which is the reproductive ratio or the rate of reproduction of COVID, and we're going to use influenza as an example of a contrast to it. The reproductive rate or reproductive for COVID-19 is 3, which means in simple layman's language, that for every single person that contracts COVID-19, that person will go along to infect 3 other people. Whereby when we look at the influenza, the flu, the R naught, or the reproductive ratio, is 1.3. We're going to look at something called the series interval, which is the period where the symptoms start in second patient that is infected. So if you're patient 1, when patient 2 actually gets infected, the period of time it takes from patient for you to develop symptoms, that is called the series interval. The series interval for COVID-19 is 4, whereby the series interval for the influenza is 1.3. And you'll see the reason why. Now, I apologize up front. I am not the best artist, so I didn't do well in art. I wasn't probably the kid who got put in the back of the classroom when it got to art. But I'm going to look at this. This is the rate of transmission explained. Now, this is patient 1, the little green man here that you see my cursor circling. That person infects 3 other people, and that is that place. And then that person, these 3 infect these 3, and they go along and infect these folks. So when you look at that now, you talk about, and you add in the rate of transmission and series interval, look at this. So from patient 1 to the second wave, that's a 4-day interval. From these patients to the next set of patients, to these 9 patients, you get another 4 days. These 9 in turn around infect another 27. So what we're looking at, in a period of 12 days, we have 40 active cases, regardless if they're asymptomatic, meaning they have no symptoms to people having symptoms. But one person just suddenly becomes responsible for infecting 40 people. And that's just in a 12-day period. If you want to take this out further, these 27, when they infect other people, they will infect another 81 people. And therefore, you have 80 plus, you have close to 121 people being infected in the course of 16 days. So that is why coronavirus is not like the common cold. It is much more dangerous. Now, when you take the number of cases and you map it on an x-axis, you'll see this how corona goes up. It has an R naught, or the rate of reproduction, which is greater than 1. Influenza has an R naught of less than 1. So over the period of time, so influenza will basically flatten out in its infection. COVID-19 continues to expand. Now, it's also important to know that COVID-19 and the influenza are both coronaviruses, but COVID-19 is a more virulent and deadly actor. So when you talk about how do we decrease the rate of reproduction, self-quarantine and quarantine, stay out of large crowds, maintaining proper hygiene, which means, and social distancing means proper washing of hands, wiping down common areas, maintaining social distances. So remember, we looked at this curve here. By doing all of that, we will see that this here, the peak should start coming down and should start flattening out. So that is why it is important for us to maintain social distances and keep away from each other. Tracy?
Is it my turn already?
Yep.
So I was going to talk to you a little bit about what to do. I think that we had a meeting a few days ago, and we all feel like having services for most people is probably premature. And so ideally, a virtual service, which is what we're doing right now in Knoxville. I think it's really early in the disease to know what's going to happen. But if you have to get together, then we want to talk about how you might do that safely. So we have talked about if we're going to get together, maybe doing a drive-in service where people stay in their cars and there's no contact. If you are going to be around people, then follow the guidelines for the number to congregate. I think right now it's 10 or under at a time. We recommend that everyone wears a mask. The mask, some people think, well, if I wear a mask, I'm protecting myself. Really, you're not protecting yourself. You're protecting those around you, and so everybody must wear a mask. We advise that there's no touching or hugging. Some people have talked about maybe doing a bow to see, as a way to show respect.
If my camera is on, there should be a little dot there. Are they saying you're not on?
And we can hear Lori there, so we'll get Mike to mute her or something. Thanks. Sorry about that, Tracy. Go ahead.
That's okay. I'm looking to forward the slides here. Trying to find out. How do I? There we go. Okay. Some people want to talk about wearing gloves. We don't advise wearing gloves unless you're trained in how to use them, because there's a lot of people wear them. They don't know how to put them on. They don't know how to take them off. They cross-contaminate. So it's better not to wear gloves and to just wash your hands. Maintain 6 feet between all people circumferentially, not just front to back, but also sideways. Even if wearing a mask, you should be 6 feet away from people. I saw someone in the hospital the other day. There's a group of people all wearing masks. They were right huddled together. If you're going to have a service in a building or get together in a building, I would lower maximum capacity to make sure you can maintain your 6 feet distance. If you're going to do communion, I think Lori's going to talk about communion. If you're going to do communion where you go up to the communion table, lines on the floor 6 feet apart would be a good idea to help you identify where that 6-foot distance is. If you have chairs, separate them. If you have intervening chairs or pew space, put plastic between them or something to mark what the 6-foot difference is. I know some people wrap the intervening chair so that you can't sit next to each other. People can't sit next to each other. And then cleaning is very important. Ideally, you want to wash your hands with soap and water. If you don't have that, or if it's not convenient enough, then hand sanitizer is a good idea. We advise you have those at all doors and other high-touch areas so people can easily have access to hand sanitizer. Again, no gloves unless you really know what you're doing. We recommend that you use appropriate cleaner and disinfectant for high-touch surfaces and to clean them frequently. Cleaning and disinfecting are different. I saw a webinar about this, and they recommend you clean first and then disinfect. You can use the same substances, but some disinfectants need to stay on the surface for minutes. Sometimes you need to spray the surface and let it dry. So, probably for that would be at the end of the service, go around and put your disinfectants out and let it sit until your next time you get together. As far as monitoring goes, if you're going to get together or if you're trying to decide whether you want to get together, you need to monitor what's going on. That website that Dr. Williams mentioned might have that information on it, but I know the CDC does as well.
It does.
It does?
Yes.
Okay. So you need to see how many cases are in your area. If cases are increasing, you might need to back down. I don't know if I'd go straight with the state guidelines. We have a very high-risk population, and I don't think anybody really knows enough right now. We're kind of guessing, and this isn't really an economical issue. I know it's a spiritual issue, but we need to keep our people safe. I would recommend that if the case count starts to increase, we decrease contact. And then he has that website on this slide as well. That would be a good one to keep your eye on. I'm going to mention something about chronic respiratory diseases just to let you know. For people who have these, they're at high risk. Examples are asthma, pulmonary hypertension, COPD, or emphysema. This is a disease. These are diseases of the lungs and airways, and this virus causes pneumonia in healthy people, and people who have lung compromise are at more risk for having significant morbidity and mortality from this disease because their lungs aren't healthy to begin with. And so these are the people that are really at risk for ending up on a ventilator and dying. So they need to be really careful. I would say they probably should stay home, and hopefully they will. Pneumonia compromises the lung and decreases oxygenation, and so people get what we call hypoxic. They have low oxygen, and then that affects your organ function, your brain function, and that's how people die. It's not the only way people die, but it's one of the ways. And so I think Lori's next if she's here.
Yeah, this is me. Okay. Until I'm going to take this in. Now, within our MCC population, we have been prior. We were the church with HIV and the church with AIDS. We have a lot of our members who are HIV people living with HIV, and we have a lot of people who have cancer. One of the reasons why this becomes rather significant is that when we talk about comorbidities with people with COVID, if you have a cardiovascular disease, the chances of you that becoming particularly lethal with COVID increases by 10.6%. If it was pulmonary disease, it's 7.3%. With diabetes, it's 6.3%, and immunocompromised patients, it's 5.6%. An immunocompromised system can be temporary or permanent. If it's temporary, it's things like you have a nasty cold, bronchitis, bacterial infections, some viral infections, some different types of infections there. And it could be permanent, where you have cancer or HIV, lupus. Your immune system is involved with the body's defense, such as your white blood cells. So you could have a lack of white blood cells that the phagocytes that basically eats the infection, eats the different invading cells, and it kills microbes or problems making adequate antibodies in response to foreign agents, organisms. Chronic conditions that affect the immune system include heart disease, lung disease, lupus, diabetes. Conditions that can leave a person immunocompromised include cancer, HIV, AIDS, malnutrition, and some rare genetic disorders. Chemotherapy and steroids can also lower your immunity in that they suppress your body's ability to activate the immune defenses by destroying certain immune cells. Attacks your T cells, your CD4 cells, and that becomes an issue when you're trying to fight off an infection. And this blunts your cell's ability to spot and kill bacteria, viruses, or other pathogens. Some consideration of people living with HIV and AIDS and COVID-19. The risk of getting very sick is greatest for those with a low CD4 count and not taking any antiretroviral therapy, meaning you're not taking any medicine for HIV. People living with HIV can also be at increased rates for COVID-19 based on their age and other medical conditions, some of which we just went over. The best protection is to avoid exposure at all costs. People living with HIV should continue to eat right, get at least 8 hours of sleep, and reducing stress as much as possible. And you should, if you're HIV positive and on medication, ensure that you have at least 30 days supply of your medication. Now, before we get to questions, Laurie's going to talk about diabetes. Laurie, you there?
Yes. So I'm grateful
Okay, so
that you all are here, and I hope you can hear me. I'm going to talk about diabetes and also cardiac folks. So these are the people and the reason why we need to be so careful at church. These people have so many difficulties with their health, and you know how interrelated the lungs are with the heart. So keep in mind, all of us have to stay healthy, and we have to stay socially distant so that we can maintain health in the airspace around us. So particularly when we have folks who already have so many difficulties like hypertension, high cholesterol, diabetes, and all this is affecting their lungs and their circulation. We have to keep in mind that these are the people who are so much more vulnerable to this infection. And now that we know that it's also causing blood clots and can disable the whole circulatory system. We have to be careful by prevention rather than by trying to fix it later. So we've learned all about how to clean the church, and particularly cleaning those things that are public, like the doorknobs and the bathrooms and the seating and everything else that people will touch. When we're talking about churches making decisions about how to best care for their congregation, in larger churches, medium-sized churches, remember to choose your social distancing by blocking off seating so you can only seat 50% of the folks, and have an overflow room so that you can have live streaming in another room to cover the rest of the people who will also be doing social distancing. At that point, you want to be able to have services that are meeting the needs of your people while keeping everybody safe. So remember, when you're measuring social distance, that it's not just to your right and your left or front and back, but it's a whole circle around yourself. So if you find that you are too close to the person on your front corner, then that means you need more space between the chairs or between the people. So let's talk about communion for a moment. We've talked with Clinton in Palm Springs, and he has given us his best idea of how high church communion can best be safe for your church. So keep in mind that you'll have an officiant, and doing the service, the blessings, the chalice, and offering those from an altar. And at that point, you have to choose, are you going to offer to serve only the host, or are you going to offer to have them dip their host themselves? So when the officiant has blessed all the elements, then either that person or another will bring the tray, the plate of host, and give one host into their hand. So you're not serving to their mouth directly. They will be serving themselves from the host in their hand. So all these ways are ways to keep everyone safe. Some churches may be using elements that are already wrapped in terms of the juice and the host being individually wrapped for individual consumption. So if that's in your budget, you can also provide the host and the juice and bless them and pass them out to each person. I know when we're doing church on Zoom, everyone is asked to bring their own elements so that we can have communion together.
Okay. Just to add to that, for the folks of the Orthodox, the Catholic, and the Anglican traditions, typically the person who is going to be distributing the elements would suggest that you offer just one element, which is the host, and the person offering that element should be masked and a glove. And so therefore, there is no contamination, and you basically just give the host and call it a day at that. The actual wine or the blood of Christ is consumed by the celebrant, and that's it. Nobody else shares in that. So that way you limit the amount of people actually exposed to that. And that's the way for those people who need the liturgy and the whole theology of communion to be sacrosanct, this is the easiest way to do it, and basically meet all the requirements of the communion. And that each congregant probably should, there is a prayer that can be said. That's for those, then for the rest of us who basically you can do the blessing and the consecration of the host and the wine or the juice. You can do it virtually, and it still meets the guidelines as far as MCC is concerned.
So I'm going to jump back in here before we get into some of the questions and just say the U.S. Council of Bishops, Catholic Council of Bishops, are saying that you can celebrate spiritual communion, so you don't have to receive the elements just at the hand of a priest right now. You can receive virtually, and it is still a legitimate communion by Catholic standards. And also what I'm hearing everyone asking in the questions here is that there seems to be such conflicting information. It's confusing for churches. They're asking, some people are asking if MCC.
Okay.
I just sent Colleen a text.
Okay.
Do we want... Oh, she said she lost internet.
Okay, so so let's try some of the questions then until she gets back.
I just want to say, I've seen some questions about, well, what is this or what is that? I think if you can't do it safely, you shouldn't do it. You know, if you really are worried your people aren't going to follow the rules, I would just do virtual service. Personally, what do you think?
Yeah. So I'd say that the question is, what you're going to do is some people won't just want to stay in their car. So I'm being practical minded here. It's just that remove the temptation. So if you go virtual, they won't have anything to get out of to come, because part of the issue is when they get out of the car, it's not, you have no idea about that person's health status. Are they COVID positive or not? And that's where paranoid starts setting in, and then you start playing around with the ideas of stigma, of that you're not accusing somebody of being COVID positive or not. In HIV prevention, we generally say assume that the person is positive until proven otherwise. In this instance, if they are going to get out of their cars, etc., I would say they're incalcitrant. Try and appeal to them to say, hey, look, we got it. However, we're trying to basically protect other folks. Think about other people in the congregation who may have some comorbidity factors, the diabetes, the hypertension, the COPD, the emphysema. I said, who to tell somebody has this, give this to them and, put them at risk. So I would say try appealing to their better nature and see if that helps. Outside of that, if it's that volatile, I'd say hold off for a couple more weeks and see how things go in your area before you actually open up and allow people back in. Because right now we're seeing there's a company in Singapore who thought they had this thing beat, that just basically came up with 900 new cases in a wave today. So bear that in mind.
Thank you, David. While Colleen is trying to get her internet connected, I'll ask the next question. There's a question: if we're paying attention to guidelines, which ones should we really listen to and which ones should we be ignoring?
I'd like to answer that. It seems that guidelines are here to help us. And basically, this particular virus is out of control. If we don't create safe guidelines for ourselves, meaning social distancing, meaning caring for ourselves, we also know that people who are tested for the disease, a large percentage of them have no symptoms at all. So they don't even know that they're carrying the virus. So I believe that we have to go with medical guidelines, and we have to go with best practices in terms of keeping everyone safe by distance and by not coming together in small groups, and by using virtual church or spreading everybody out as far as we can.
Thank you, Lori. Then there's the question of people coming forward for communion. Should we even do that, or are there other ways to deal with communion other than having people come forward?
The only other way, if they're not coming forward, because that's why we're saying if you lay down the tape on the floor and say, okay, this is what each person said, if that is untenable, then the other way is to have it distributed by a set amount of people who are gloved and masked, and that they keep the communion, the patine covered, because at that point what you have is something, if you don't need fomites on being spread, and fomites are when if somebody's COVID positive, they spray the droplets, the aerosolized droplets go and they settle on the communion wafers. That now you have a mode of infection. So if you keep it covered and you keep masks and you keep a clean glove and you put it into their hands, and that's the only other way I could see them, the communion being distributed if they insist on being in church.
Thank you, David. And then there's some have heard that the virus is shareable up to 20 feet apart. How effective is the 6-foot distancing? Is that enough? Okay.
It's shareable when you are talking about when you're forcefully expulsing the air from your chest. So basically, when you're singing, when you take a deep breath and you project, yes, you're gonna, the force that you're pushing the air out of your lungs is gonna go past 20 feet. But 6 feet is generally a good idea, because at that point, at 20 feet, it's pretty much very well diffused into the volume of air surrounding you. So 6 feet is what the research has shown is an adequate spacing for the time being, unless something else comes up. So right now, 6 feet seems to be the given rule.
Thank you. And then how do we know when we should gather again with the guidelines?
Okay. That one, again, comes down to what's happening in your area. Take your mortality rate. Now, if you have, today you have 5 people that got infected. Tomorrow you have 7, next day you have 9 infected. That means the number of people being infected is going up. Then I would suggest that you hold off. Now, if you see over a week, the trend is that it's decreasing, I'd say take a 2-week snapshot and look to see what the numbers look like. If it's decreasing, then yes, you probably can try doing a controlled opening if you insist on doing it. If not, stick to it. And if you're not quite sure, you can always ask, and we probably can take a look at it and give you a recommendation up or down about whether you should open up or not.
And you went over some of the chronic respiratory diseases. And so the question is, those who live with people who have chronic respiratory diseases, should they also stay home? And I suppose that would go along with any of the other compromised immune system people living with those people as well.
Yeah. If you have somebody with these comorbidity factors, the best way to say they should stay home. And if possible, the folks living with them or people caring for them should limit their exposure to the outside world. So if you go into the supermarket, do not make going to the supermarket a daily exercise where and you meander up and down the aisles. Oh, this looks good. I wonder what's on sale. Make a list and be very strategic that you get in and you get out. Do not go every day looking like, I'll take this. I think I'll go get some of this today. Make a list for at least 3-4 days if you possibly can. And I understand that sometimes money may be an issue, but where possible, limit the amount of times you go to the supermarket and you go out into the outside world. Because one of the things that can happen, people can self-isolate and they can be sheltering in place. Somebody goes out and comes back in, and they bring the virus in. I have just had a case this week where a woman, she sheltered in place for 3 weeks. Her son went to work, came back home, and brought the virus back in. Within both of them tested positive. She's now dead. So if you live with someone, limit how you go out and put on a mask. When you go to the supermarket, there is a reason why they give you the wet wipes, the antibacterial wipes. Wipe down your tray, your basket that you have. Just wipe it in one way. Put your stuff in there, and you just basically dispose of your gloves responsibly. Meaning, do not take them off if you're wearing gloves. Do not take them off in the parking lot and leave them there. They become a biohazard. Dispose of them in the garbage bin. I hope I answered that question.
And do you have any suggestions on how to keep people home, even if the church is open, or those people that should be staying home with other ones?
I would respond to that by saying, you know your people in your church, and you know who are much more vulnerable. I think it's reasonable to have video or phone contact with folks who are staying home and commit together that we're all trying to help them stay well. Convincing them that they shouldn't come if the church is open, then they need to have a separate room where the service is also being projected. So be careful with that. People have to make their best choices, and if it's not safe for your people to come to church, then have virtual church.
And then add to that, Laurie, if you don't feel well, stay home.
And so there's another question about best practices for disinfecting cloth seats and carpet. How might we be able to keep the sanctuary and other common areas clean?
In my office, we use Lysol, and there's a virus side, but I don't know if you can get it if you're not a medical professional. But Lysol's supposed to do it. You just spray it on there, and it's theoretically, I would think it would work. I don't know how important it is to disinfect the carpet. What do you think?
No, first of all, I wouldn't anticipate a lot of infected material getting onto the carpet, because remember, folks, when you sneeze, there are going to be paper tissues. You sneeze into the tissue or into the cork of your hand. And if you use the tissues, churches have a lined waste basket close by where people can just drop it in, and all you have to do is just tie it off and put it in the garbage, and that's all you need. It'll be incinerated by the folks. But carpet, I don't see a lot of infected material be coming up on the carpet. Reason why you see us use covered boutiques in the hospital is because we have floors that basically it will stick to a lot easier. So cloth seats, Lysol is your best bet.
Thank you. There's a question. It seems like we are going to be living with this disease for a long while. Once the government reopens us, do you recommend we refuse to reopen beyond online offerings until the denomination tells us to do so?
I would like to speak to that. Wes, I think you have access to really good information about the number of cases and whether your area has peaked or not. I think it's important to look at your local information. The truth is, we're going to be living with this disease until we have a vaccine and until we have reproducible antibodies that can be shared to help people prevent or treat illness. So I don't think it's necessarily whether the denomination is going to tell us when to open up. I think we have to be able to stay virtual and to stay in contact with our people so that they feel connected without necessarily all meeting in the same room.
And then there's kind of a follow-up to that too. What role do we have in simply stating the risks of coming to church, even with protective measures, and letting each member make their own individual choice, trying to find the balance between deciding for people and letting people decide for themselves?
Here's the deal. Folks, if they're going to decide for themselves, they should also realize that they're deciding for their fellow members also and their leaders. Because let's face it, our denomination, majority of the denomination is older, have a lot of the comorbidity factors, and that if you're going to insist on coming to church, they probably, our best way I say is remind them that you're making a decision not for yourself, but you're making a decision to affect somebody else within your community, within your church, your family, and work it from there. Dictating, it's going to be a case-by-case thing, because I'll give you an example. I'll make it more personal. I have hypertension. It's just a familial thing. Somebody is, and I decide, okay, we're going to open up church, and somebody comes in not even making that decision. At that point, yes, I run the risk of that person infecting me, and I run into issues if I get infected. That's the responsibility of the folks that have to take. And in terms of the easiest way is to, all I can say is tread lightly. Because you don't want folks saying that you're trying to step over their civil rights, whatever, but at the same time, walk lightly, but be firm at the same time about what you're going to do. And if you, as the church pastor, you do not feel, or the board, you don't feel comfortable in actually exposing people to the risk, then you have the opportunity to stay virtual until the situation resolves itself for either better or worse. I would rather say err on the side of caution rather than cast your breads up on the water and see what happens.
Thank you. I think it was stated earlier that when we do reopen, we should only allow 50% capacity. And so there's a question is that the right number? Apparently the governor in Texas has said that the person thought it was too generous even with only a 25% occupancy. So is 50% the right number, or is there a better capacity?
Okay, when I say 50%, well, I'm talking about 50% of what your building is zoned for, not 50% of your membership.
I would say it can't be more than if you can keep your 6-foot distance. I mean,
yes,
for sure. And I don't know how many churches. I think it'd be less than 50% for most churches. I think the 6 foot is the most important thing when deciding that, to me.
Great. And going back to some of the communion things, would you recommend putting communion elements on a table and asking people to pick up their own?
Not initially. It probably should be distributed by one person that, there's no contagion there, because the communion elements should be covered during the consecration. They should not be left open. Because the moment you leave it open, you're now subjecting it to other people getting it contaminated. So if you leave it covered, and when the time comes from one person who is masked and gloved takes the host and put it into the person's hand. That's probably the safest way. Because what you're looking to avoid is cross-contamination.
So they need to make sure they don't touch the other person, right?
Yes. And you make sure you don't touch the other person. You just put it in there, you just drop it in their hand, they take it and put it in and consume it.
There are a couple of questions about choirs and music and singing, and I know you touched a little bit on that. Colleen did do an interview with a person, and she recorded that. It's Dr. Tim Seelig, and so I'd like to just show a little bit of that video so you can hear what he has to say about singing and choirs and things like that. So I'll switch to a video for a moment.
Doing research because it's what I do and it's what I've been doing, and I'm a vocal pedagogue. So I love doing this. In the research that is out now, we started out believing that this was only tactile. It was, you had to touch something to get the virus. And it's only in recent weeks, really, that it's switched, hence the masks, to aerosolized or on air. It's born on air. And all of that research is still very new about how far it really can carry. Many people say it's farther than 6 feet, because what has been learned is that the particles in which the virus is carried are much smaller than we immediately thought. So therefore, spray from your mouth, born on breath. So, you know, there's so much, we spend so much time talking about the breath in singing, but also the breath in life. And our spirits, our souls are carried as I am to you on breath. And of course, everything that you've sung with me for off and on for all these years, everything is based on the breath, and everything is based on the breath moving. That's what we do. We move the breath past the vocal folds from the lungs and trachea where the virus is sitting. And so that motion of air through the larynx, there's many of these particles are coming from the air waves. So your trachea from your lungs, but also from touch something to get the virus. And it's only in recent weeks, really, that it's switched, hence the masks, to aerosolized or on air. It's born on air. And all of that research is still very new about how far it really can carry. Many people say it's farther than 6 feet, because what has been learned is that the particles in which the virus is carried are much smaller than we immediately thought. So therefore, spray from your mouth, born on breath. So, you know, there's so much, we spend so much time talking about the breath in singing, but also the breath in life. And our spirits, our souls are carried as I am to you on breath. And of course, everything that you've sung with me for off and on for all these years, everything is based on the breath, and everything is based on the breath moving. That's what we do. We move the breath past the vocal folds from the lungs and trachea where the virus is sitting. And so that motion of air through the larynx, there's many of these particles are coming from the air waves. So your trachea from your lungs, but also from higher. And interestingly enough, more concentration here than in your spit or in your mouth. So therefore, it makes singing even even more dangerous. There's a list of the danger, how it's transmitted through air, and it starts with breathing gently through your nose and goes through whisper, which is still fine because it doesn't activate the vocal folds. And then it goes to speech, and then it goes to singing or coughing, and they're equal in their danger. And then sneezing is potentially the worst because depending on how you sneeze. So we are talking about something that singing is in the danger zone of transmitting the virus particles. So what do we do about it? What do we do with that information? Well, you can't stop singing. You can't stop using air. You can't sing without consonants. All those things that activate the vocal folds. The minute I start breathing from my diaphragm, then the air starts flowing, and there you go. For us, we are looking at when we are allowed to start back. I have too many people in my choir. I have 300 people in my choir. So there's no place we can go and spread out 6 feet. But the more important and interesting things that have come up about joining back in for church or meetings are not the actual, once you get there and you're 6 feet apart and you're singing or you're rehearsing.
So there is that whole video is about 15-20 minutes long, and we'll send out the link to the whole video. But did the doctors want to respond to anything that Tim said?
I was thinking that when we spoke about singing, we just basically came to the conclusion that you're going to have people singing, put a mask on them. And the reason why the masks are recommended is not to protect you from other people, it's to protect other people from you. The mask basically keeps your germs to yourselves. It allows you to keep whatever you have to yourselves. That's why we wear masks in the operating room. It's not to protect us from the patient. It's to make sure that we do not infect that patient with whatever infection or whatever microbes that we have by breathing onto them or breathing into that open wound. Similarly, with wearing a mask here, is to keep whatever active infections you may have, whether it be the cold, a common cold, the influenza, COVID-19, whatever it is that you have, it basically stays. You make it self-contained. So if they're going to sing, it may not actually sound as beautiful as it can be because they may be muffled through the mask, but that's the only way I can think of right now, because until we know more and until we can actually get this virus to the point in that it's under control, singing, sneezing, coughing is one of the most dangerous acts you can actually do. So, and you cannot put a napkin over your mouth and you just like sing the wondrous love of Jesus. It's not actually going to come out that great. So wear a mask and see how that works. If you open back church and this is what folks want to do, then they're probably going to all have to wear a mask.
There is a question out there, how long does the virus live outside a host, in the air, or on surfaces?
Depends on the surface. It seems to live longest on aluminum and hard contact surfaces. So it can last from anywhere from a number of like couple of hours to actually like 24 to 30 hours, depends on the surface.
And do you guys know if there's any liability issues to consider in addition to health and safety issues for churches gathering again?
Hold your world all together, and I'd be lying if I said I knew what those were, because somewhere along the line somebody's going to make case law with this, saying that somebody was responsible for getting somebody infected when you knew the risk. So it's just a matter of time. It's not if, but when.
Yeah, I think there's
And
a huge risk, personally.
Don't you
I
think it would be
believe-
better if the church itself made its own criteria and its own guidelines and consulted other legal help in order to set a precedent and stay within what they have chosen?
I also remember Colleen mentioning that I believe Jacob Hero, the pastor at MCC Tampa, has done a little bit of research on this and has come up with some guidelines. And so we'll make sure that we can get those out to everybody. We'll get them from him. It looks like Diane Fisher also has done some of that work. So we can get that out to everybody. This entire webinar has been recorded and we will provide it to everybody. There are some questions that we have not been able to get to, and we'll also get those to the doctors to have them answer the questions, and we'll put those all together and put them in an email. If you have additional questions for the doctors or for the denomination, send those to communications@mccchurch.net. I'll put that in the chat box. And then that can we'll add those to them. How will the email will be sent out to just our general email list. So there'll be another email blast that will have the questions as well as the link to the video to this. Doctors, do you have anything else to say in closing? Otherwise, we'd just like to thank you for giving your time today.
Thank you, Mike. Thank you, Colleen, for organizing us.
Yes.
Yeah, thanks a lot.
Thank you. Thank you.
Thanks for everybody who showed up and participated.
I would just say we just need to be patient, I think, and not rush it.
All right. Thank you again, everybody. Look for an email with a follow-up with additional comments and questions. Have a great day. Stay safe, everybody.
Yeah.
Bye.
All
Bye
right.
now.